obviously for businesses, there's this desire to, maybe for everyone, to kind of get back to what's the next phase. And what would, from a perspective of not spreading the disease, what can we expect as business owners to have our procedures in place in order for us to keep going? Can you speak to that? It's not quite your maybe pinpoint expertise, but with your expertise around infectious diseases, I wonder if you can speak to what what that might look like.
So the first thing I'd say is we're getting into total conjecture, right, is to answer that question. So I'd caution with that. And then I'd caution to say that my answer would not be on behalf of Fraser Health, but as a personal opinion. So that'd be the other thing to sort of say. And then the last caveat is that I'm not an expert in public health. So you got three caveats before I answer any question around that. But just to lay it out there, so take it with a grain of salt.
Okay, so if anybody's using that as a soundbite, make sure you keep the caveats in there.
No soundbite on that one. So so now when you think about it, right, when we're looking at the curve and looking at social distancing, BC has done probably between a mix of luck and good leadership. We've had a very, very flat curve. But for now, we don't know what's going to happen over the next few days and even weeks, but it looks pretty good right now. Now, what is that actually? The thing to remember is that epidemic curves are actually all local epidemic curves. So Vancouver has one, and even downtown has a little bit of a different one than we do in Fraser Health. But definitely different than Ontario, different than Quebec, different than and even when you talk about the epidemic curve in the U.S., it's thousands of small epidemic curves, depending on a bunch of local different factors. One article I read, which was I thought very insightful, is Quebec was quite disadvantaged because their spring break was early, and so people before the travel ban came into effect, a lot of people were coming back from places, and they have a strong connection to France and things like that. So we were lucky, I think. Sometimes it's better to be lucky than to be smart, but we were lucky and had good leadership. But that does get to what's next. That's your question: is how does this impact on business? How do we get back to normal? And recognizing that that it has a massive economic impact, right? And how do you balance the economics versus the need to socially isolate? So then taking a step back around that, for the community to get resistance to this virus, we talk about herd immunity. Herd immunity is when 60% of our population or more gets the virus, and it starts to slow down in the community in terms of how much it progresses. So that 60% resistance, either you get it or you get a vaccine, one of the two. When we flatten our curve, the great news is that our healthcare system can manage with the influx of patients. And that's where we are right now. We've pivoted, we've changed, we're working really hard, but we can deal with everything that's coming through. Now, but what that means is fewer people actually get the disease. So in places like New York, where it's just a massive amount of infection, it's really quite challenging for the healthcare system to provide care for these folks, and everything is different. But that being said, a lot of people are getting the disease very quickly, right? And so you can imagine we flatten the curve, it's going to take a long time for folks to for a population to get this. We don't understand how fast that's going to be because we truly don't understand how many people are asymptomatic with it, that they get it, they clear it, it's no problem for them. But there may be a fair amount of those people out there. So then in terms of how going forward, that's really the decision at the provincial and the federal level. But there were some indications that it will probably be a slow movement towards more normal stuff as we know that our systems and our healthcare system in particular can manage with the influx of patients. What that looks like, I don't know. But I do know that people at the top level are carefully looking at, we need our economy to work, right? Like we have to have our economy to work. We have to have our supply chain. We have to be able to go forward from this. And what does that look like? We don't, it's a scary dynamic when we're talking about lives and economics, but we do have to talk about economics because we need the system to work, right? We need to be able to buy our stuff. We need to be able to do that. So I don't know if that answers all of your questions. It is a reflection on the fact that at some point when we feel that we do have a handle on this, that the perception is that we'll start to back off on some of the aspects of sheltering in place.